If you've randomly received an RX savings card in the mail over the last couple of weeks, you are not alone.
These cards are being sent to folks here in the capital region from a group called the National Prescription Assistance Network. Many of you have contacted us asking us if these prescription cards are legit. So for that, we bring CBS 6 investigative reporter Jennifer Lewke here. She's on the case with the real deal when it comes to these cards. Let's have her.
Yeah, well, Cody, basically at first glance, they look similar to an insurance card, but printed right on the front, it says this card is not insurance and it's not affiliated with the government. So what exactly is it? Here's the real deal.
Most of us rely on some sort of medication to stay healthy, but the price of those pills has been on the rise for years now.
Pharmaceuticals today is the most profitable sector in healthcare. I mean, I think the running profits at around 20% overall, and that's more than 5 times what health plans and hospitals earn in terms of any kind of a margin.
Those increases don't just cause higher premiums, they cause higher co-pays too.
Last month I had to order like six different prescriptions again, and it came to quite a bit. I'm on a fixed income, and it's hard to plan sometimes.
Kathy Wooten couldn't plan either when the price of her biologics more than tripled.
I need the drug. That's the bottom line. But I need it within reasonable cost.
That's why most of us will consider any kind of discount we can get. So when these cards arrived in mailboxes, we got a lot of questions about them. Here's the real deal. The cards are primarily for people who are uninsured or for those of you who have a prescription that falls outside of your coverage. Basically, instead of paying full retail price, this card allows the pharmacy to process the script through a benefit manager, a middleman of sorts between drug makers and pharmacies. If you have insurance, you can present both your insurance card and the discount card and see which would offer a better deal.
How are you?
We spoke with the company behind these cards today.
How are you able to offer those discounts?
We're bringing individuals into the system to get, if you will, network-based pricing so that they don't have to pay full retail.
If I use your card, what sort of information do you then have about me?
I only know that you, your first name and last name, bought a drug at a specific pharmacy. That's the only information that's returned to me. And we do not share, sell, rent, or enable anybody, including ourselves, to do anything with the data.
If you've got regular insurance, you may not need a card like this, but they appear to be particularly useful for those who prefer a name brand but have been forced to switch by their insurer to a generic drug. So it's basically just a comparison. Give them both and see which one's going to do better for you.
And this particular card may be able to help some people, but if they arrive in your mailbox unsolicited, how are you supposed to know if they're legit?
Well, you can always call me.
There you
I
go.
can get you the real deal. But you're right. You need to be very cautious with things like this, especially with all the HIPAA laws. You don't want all these companies knowing what all your problems are. So ask. This card has a phone number on it, an email address, a website where all of these FAQs are on their site. They obviously were willing to answer our questions. So you want to look for companies that are willing to answer any questions you have about what sort of data they collect and what they're going to do with it. This one doesn't sell it. There are probably some that do. So it's good to ask those questions. And of course, ask your pharmacist when you're there and you have these 2 cards. Make sure that you're getting the best deal, but also the pharmacists are very well versed in these discount cards, so they can probably offer you some perspective as well.
Better to be safe than sorry, and better to be informed. All right, thanks a lot, Jen.
Thank you.